Cels's work internationally.
She's organised it to illuminate the issue and underline the importance of properly funded services.
The pain of mental illness is just something else, and it's so private and so hidden, and it's the early stages where you need the help soonest, you know, when you start to fall apart, that there is so much more could be done, and that just, it just doesn't exist in a lot of places, or it's too late.
Parity of esteem, that's giving the same priority to physical and mental health, was legislated for by the last government. But our investigation shows that the funding of mental health trusts has lagged behind that of other providers, and many are facing cuts. The funding of mental health has risen rapidly up the political agenda. We made freedom of information requests to mental health trusts in England asking for details of their income. Around 90% responded. If you add them all up, and after stripping out the effects of inflation, income was down by 2% in the 2014 financial year. In the current year, there's set to be an increase of 0.3%. But even with that overall increase, 29 of the 53 trusts which responded said they expected income to be lower this year. We asked health boards in Scotland, Wales and Northern Ireland what they were spending on mental health. Almost all responded. After adjusting for inflation, spending in Scotland in the 2014 financial year increased slightly, but in the current year it's been lower. In Wales, after falling in 2014, spending has been increasing this year. In Northern Ireland, spending on mental health has increased in both financial years.
Problems in our hospital sector mean that money increasingly is getting sucked in to meet their rising costs, and the NHS is struggling to actually commit resources to fund mental health providers.
The Department of Health said other organisations provide mental health services as well as the trusts covered in our research. The Scottish Government and Northern Ireland Executive both argued they were investing more in mental health, while the Welsh Government said independent analysis showed its spending had gone up every year. The question of mental health funding is certainly a sensitive one in all parts of the UK.